Hi friends, I am Dr. Rohit Udaya Prasad, Consultant ENT Surgeon and Cochlear Implant Surgeon at Aster Hospital, Bangalore. I am going to talk to you about sleep apnea today. Sleep apnea is a potentially serious sleep disorder which people experience wherein there is multiple episodes of holding of breath while sleeping, wherein there is continuously the patient will stop breathing in between and restart breathing. These symptoms of snoring and issues where patients find it hard to breathe during their sleep is a potentially hazardous issue for a patient of any age group, and patients should come to the hospital to figure out what the problem is. Sleep apnea can be of an obstructive cause, which can happen in the upper airways, which start from the nose and get to your throat and into your larynx, wherein there is going to be an issue of breathing because of narrowing of the airspace. Also, sleep apnea can be because of a central cause wherein there is not proper signaling from the brain for the patient to keep breathing when they are sleeping. When a person is sleeping, the breathing is involuntary. If there is any form of obstruction at this point of time when the patient is breathing, it can lead to certain issues where the patient can have breath holding spells because of lack of oxygen getting to reach the brain due to the obstruction, which suddenly will wake up the patient and the patient will feel breathless when he wakes up. This is a very poor condition for a patient if they are not getting to the hospital in quick time, because a lot of people don't know what to do when this happens, or they think that it is normal. Most commonly, patients will present with loud snoring. Multiple at times, the patient can get up at night when they're sleeping. Inability to get back to sleep, leading to insomnia. Dry mouth. Patients will have a lot of daytime sleepiness or drowsiness. Inability to focus on any work in the routine working hours. A lot of the times the patients will also be gaining weight because they're not having good metabolism, and which in turn causes more issues with their sleep disturbance. If people are experiencing these kind of symptoms, you need to visit your ENT surgeon to get evaluated to figure out what the problem is and where the problem lies and what can be done to treat this issue. When you have such an issue, first thing is you should get to your local examination done, which involves your upper airways, which is your nose, your throat, and your larynx. More of the times patients do visit a pulmonologist to get even their lungs checked up, and also sometimes patients do visit their dentist if they have issues with their jaw. The most common tests that we can do to figure out if there's a problem is by doing a sleep study. A lot of the times it can be done even at the patient's house, wherein they're most comfortable. If they're sleeping at their home on their own bed, they feel more at ease to get the test done. This test will tell us whether the patient has got a mild to moderate or severe sleep apnea, and we will be able to get to know how many times the patient has an apneic spell or a hypopneic spell or lack of oxygen, how many times he wakes up, which will enable us to figure out how much the patient is struggling to breathe at night. Once this is done, we can also do a local examination and also do a drug-induced sleep endoscopy to see how narrow the airways are by inducing sleep via medications and checking out how narrow the airways are, whether there is a circumferential narrowing, and then plan accordingly what has to be done. Most of the risk factors that can lead to this is patients we find having a problem of obesity, wherein there's going to be fat deposition around their airways. Sometimes they can have a very short neck. Patients who have a family history of sleep apnea also, they are also prone to getting into this condition. Certain patients who have a habit of taking alcohol or certain tranquilizers or medications can also end up having these issues where it can get worse. Even smoking can lead to these problems, wherein it should be taken very seriously, where patients should stop smoking. Once you get to know that you have this sleep issue, first thing is, after getting your diagnostic evaluation done, there is ways to manage these issues medically, and if medically it doesn't work, you can manage it surgically. Medical management is first the most important thing to be done. If it is a very mild sleep apnea, mild to moderate sleep apnea, a lot of the times patient can be encouraged to lose weight, to exercise, to change over to healthier lifestyles, to avoid smoking, to avoid alcohol consumption, and kind of reduce the effort of breathing or having the apneic spells at night. If the sleep apnea is of a higher grade, initially what happens is when they are sleeping, the airways will collapse and narrow down, making it difficult for the patient to breathe and reducing the oxygen input to the brain and other vital organs. Once the oxygen supply to the brain is sensed as low, the brain wakes up the patient and the patient will come and sit up. So to provide that correct amount of oxygen, we need to keep the air space open. Most of the times these patients experience collapse of the airways in the throat region, wherein the airways will collapse because of the soft tissues will start collapsing. If you have an obstructive cause inside the nose, which is of course a severely bent, deviated septum, a nasal septum, or obstruction with a lot of polyps, they are all obvious causes which need to be dealt surgically first. If there are not obstructive, if you don't find any obstructive causes inside the nose, yes, the patient will have to get first a medical line of management wherein you provide positive airway pressure through certain devices. We call it a CPAP, where the patient can wear it at night and sleep, wherein the air pressure provided by this device is slightly more than the air pressure outside, which will help to keep the air passage open, thereby helping the patient to breathe. If it doesn't work, then there are other assisted devices. There are devices which will keep oral appliances keeping the mouth open or the airway open, enabling the jaw to be thrusted forward, which also help, but these devices sometimes can get uncomfortable. Some patients are not even comfortable wearing the CPAP devices at night because they find it more disturbing than the sleep apnea itself. And some patients also, despite using the CPAP, will still have the issue of low oxygen flow and low oxygen levels in their body and not serving the purpose. Only when these things fail, surgical options are suggested to the patient, wherein surgeries are done to relieve the obstructions, starting from the nose to the throat, wherein issues are dealt with surgically. When it comes to the throat, if the patient has big tonsils, if the soft tissue has to be reduced, we use coblation techniques to reduce the structural size, reduce the base of the tongue, also do surgeries on the nose to relieve the nasal obstructions. Sometimes surgeries we are done to produce a jaw thrust forward, which prevent the tongue fallback to relieve the obstruction. People shouldn't ignore the sleep apnea because it is a condition wherein patients think that's the way they're going to sleep, or they themselves don't know what's happening, because most of the times these things are reported by another person. It can be their own partner or their own family member. Once this is noticed, I would suggest that people shouldn't ignore it, because these are all corrective procedures which will improve the quality of life on the longer run. The earlier you get these things corrected, either by lifestyle changes or by medical management or by surgical corrections, the patient will have a better quality of life, thereby giving a better health to the patient's heart, to the brain, and to the other vital organs. Because if sleep apnea persists, patients do develop a raised blood pressure, develop diabetes, develop metabolic syndromes where their cholesterol levels go high. Patients also will develop obesity because metabolism is poor, they are not able to exercise. It's a vicious cycle wherein the obesity itself will cause more obesity. These have to be dealt with as soon as possible. I would suggest all people to take these things seriously, especially when it comes to sleep, because a good sound sleep means that a person is healthy. Good number of hours of sleep wherein you wake up fresh means you are healthy. Do not neglect these small issues because they can turn into big ones. Thank you for listening to me.